Okay, and we are live. After some technical difficulties, I'm here with Dr. Megan Melo, who is a physician and life coach. I'm Dr. Sarah Merritt. This is Lifestream Health Center, our practice for pain management, where we treat patients with acute and chronic pain. We're making pain management caring, accessible, patient-centric, and evidence-based. We want to help folks in our area, which is Bowie, Maryland, and really everywhere. We're here to educate patients and talk about issues that affect the people that we care about. And so I'm excited to have Dr. Melo here. She is a physician. She's a practicing family medicine physician. She works in obesity medicine as well. But interestingly, I think today we're going to talk more about some of the work she does as a coach because her topic or her area of interest is so fascinating. Can you share some about your work with us, Dr. Melo?
Yeah. So I am a physician coach. So I primarily coach physicians, although I do incorporate some coaching into my medical practice naturally. But I really focus on areas centered around burnout. And the sort of particular lens that I take to that is our habits of perfectionism and people pleasing and boundaries, and how those really intersect with burnout. That's something that, of course, I certainly see in my physician clients, but of course, as a family medicine physician doing primary care, I've also seen so many caregivers, kind of experience many of the same challenges. And so I'm excited to talk today about, kind of how that, how those two things overlap, in ways that we can start to really help ourselves to do better overall.
Thank you. I'm just muting myself, so I've got dog barking in the background, of course. Yeah, I think as caregivers, right, we all have certain tendency. There are certain things that call us into medicine and want to help other people, but then I think there's the line and I guess the boundary, as you were mentioning, of caring for ourselves as well.
Mm-hmm.
Yeah, and so I was just putting Dr. Melo's information in the chat here, including your website and everything. So the other, and I know this isn't necessarily your area of focus, but one thing that I see in my practice that I think maybe does dovetail, and these are like my legitimate questions for you as a coach and somebody that works with caregivers. I have a certain population of patients in my practice who might have chronic pain and they are disabled in some manner, and so they have full-time caregivers. They have a family member that often comes to visits with them, or depending on how able they are, they may be able to come sometimes by themselves, sometimes with a caregiver. I know that's a concern sometimes for me, just to understand that other person as well, because they're so often like really part of the visit. If they're there as in that caregiver role, they have a lot of insight to add. Tell me about what you've learned in your work about the caregiver role in those scenarios.
Yeah, we come to caregiving, from all different, sort of perspectives. So some of us, have gone into caregiving, as our employment, right? So physicians are an example of that. But also certainly family members and friends and, people who just have this desire to help, also come into those caregiver roles. And, with all of that, the goal is to, this underlying desire to help, right? And I think one of the challenges when you are a caregiver, again, sort of no matter who you're working with, whether it's a loved one or, again, taking care of patients, you have this strong desire to want to fix the problem or problems of the person that you're caring for. And, there may be instances where, that's possible, but a lot of the time there aren't discrete fixes. So for example, let's say a patient who has, some kind of chronic pain syndrome, say, they have severe back pain, right. And it's been evaluated, it's been checked out. Yes, there are things that we're doing to help reduce the pain, but still they have pain, their function is not very good. Often as a caregiver, we want so badly for that person to feel good.
Mm-hmm.
And we can get very fixated on the way that they feel good, must be elimination of pain and, being able to do exactly as they used to do,
Mm-hmm.
prior to, kind of developing this chronic pain for whatever reason, whether, it was an injury or, kind of a chronic condition.
Mm-hmm.
And I think for a lot of us, part of the issue that becomes so draining, part of the issue that leads to burnout is, this resistance to the reality that some of those things can't be fixed.
The resistance to the reality that some of these things can't be fixed.
Right. So, some chronic pain
Mm-hmm.
will never go away.
I agree.
And it's not a matter of, the caregiver not wanting it enough or not doing enough, for the person that they're caring for, or, there's this desire, right, for it to go away. Like that must be the solution. And that's so much too of the conversations with people who experience chronic pain as well,
Mm-hmm.
right? There's this natural, totally understandable desire for the pain to be gone.
Right.
And yet when we don't get there, we are often, remaining in this resistance of this shouldn't be happening. This shouldn't be happening
Mm-hmm.
to me if I experience chronic pain, and it shouldn't be happening to my loved one, the person that I'm caring for.
Yeah. Yeah.
And
I think it can be
yeah,
challenging for the caregivers, the physician, the
exactly, yeah.
provider also. Yeah. It's a burdensome problem in many ways, different ways for different individuals in the group.
Yeah. Yeah. And, when we're constantly, believing that it should be able to be better, that there should be a solution, that there should be a fix, that there should be an elimination of the pain, which again is very understandable, it creates this atmosphere of, so resistance, is kind of the word that I use for it,
Mm-hmm.
but
Mm-hmm.
this, this kind of arguing with reality.
Right.
This lack of acceptance of like, this is the situation.
Mm-hmm.
And the things that we do get to control are how we think about it, how we respond to it, how we manage it, how we care for ourselves if we're the caregiver so that we can care for the other person.
Mm-hmm.
And of course, for the person experiencing chronic pain, how do I manage myself? How do I take care of my body, my emotions, like whatever that looks like, so that I can be doing the best that I can.
Absolutely. Yeah, I think there is just so much to unpack there. Absolutely, because I think this is a huge challenge, right, for everybody in the in the circle of the individual maybe with chronic pain that we're trying to care for. Is how do we all get our head in the right space and function well to try to, because there are things we can do, right? In my view, and it sounds like in your view too, there are things we can do to improve quality of life.
Mm-hmm.
But maybe thinking this should be gone is probably not one of them.
Right. And that conversation of like really wanting to improve function, improve quality of life. Again, if we're sort of stuck in well, that means pain should be all the way gone. Again, whether we're the person experiencing or, part of the care team or the caregiver, if we're getting stuck in that, then it's very hard to be focused on, kind of the function, the self-care, and, the emotions that are underlying.
Right.
And just to speak a little bit about the burnout piece,
Yeah.
I ran across, and I don't remember who said it, but, we think about burnout, and sometimes people will, just, I don't know if I can feel burned out. Like I just got started with such and such thing, but burnout is something that any of us can experience when
Mm-hmm.
we're in a situation where we don't have a discrete start and stop, right? Where there's not kind of an end point associated with it, and there's kind of a ongoing maintenance of the situation. So that's true often, right, in the caregiving relationship, and that could be whether you're a parent, whether you're caring for, an elderly adult, or somebody who's disabled, or any number of other circumstances where there's this kind of day in, day out,
Mm-hmm.
Challenges that you're facing. and it doesn't turn off, it doesn't get fixed,
Mm-hmm.
right? It's managed.
Yeah. Yeah.
And there's that opportunity for, kind of an exhaustion feeling and kind of a, we talk about futility of what I'm doing is not effective.
Mm-hmm.
That sensation is a part of burnout. And again, a lot of that might be coming from this idea that we have stuck in us that we should be able to fix it, right? We should be able to eliminate the
Right.
pain and disability.
Right. Yeah, I think this is definitely something that we deal with, and patients will ask, even in those terms, doc, is this something I'm always going to have? Is this something I'm always going to deal with? But I think even asking that question maybe reflects gaining some understanding very often.
Yeah, it's kind of like moving along the continuum from I'm going to consider the possibility that there is no cure for this pain, right? There are treatments, there are ways that we manage it.
Mm-hmm.
But of course, when we have an experience of only sort of having experienced acute pain, right? We've only, we've burned our hand, we've broken a bone, things like that. I think I certainly see this as a primary care provider, when we start to see people sort of in their early chronic pain phase, there's that sensation that this has to get better.
Yeah.
There's no way that this can persist. And I think that question of, is this something I'm always going to have to live with, is like kind of getting your foot in the door of understanding it's possible that this pain is just part of my life now.
Mm-hmm.
But that doesn't mean that there has to be, misery and terrible things. It just means we're going to have to sort of shift the way that we think about things, the way that we manage things, so that there is that quality of life and that improved function.
Yeah. Yeah. And I would say, and it doesn't mean we give up, to your point about like, it doesn't mean that we're done trying or revisiting anything new. And even for some of my patients who've had, many years of significant pain, there have been times we've had, specific treatments, specific procedures and things that can really make a big difference, or a new medication, things like that.
Yeah.
And I think
for me, it's exciting to see, that there are improvements in treatments, or, sometimes it's a matter of getting, the person to the right care team, right? The care team that has the resources, such as your office, trying to be able to integrate new therapies that, yes, can be effective.
Yeah. Yeah. And I think the other place this makes me think about is where for those patients who are in a stage of maybe accepting, like, okay, well, there's going to be some amount of chronic pain that I deal with, then some of the like how I deal with it can get interesting, because then there's just like so many layers of like self-care to explore of what makes a difference for me.
Right.
And I think that's a really interesting question with like unique answers for every person.
Yeah, no, I agree. I agree with that. And, sort of getting to that space of, if we can start to accept, some of the ideas that things don't necessarily go back to the way that they were before, then there is, sort of mental, emotional room to consider, okay, well, what can I do? How does this impact me? And similarly for the caregiver, if the caregiver can come to this place where they're in acceptance of kind of what their situation is, then they can start to look at, if this is the reality of, how I'm living my life. Say I have brought my elderly mother who has chronic pain, into the home with me, and she needs, a certain amount of care. If I can accept that, then I can make decisions about, how do I take care of myself, knowing sort of what her needs are at this phase, so that we can work together.
Yeah.
Yeah. And that's really important work. And I think we don't talk about that enough. We might recommend people, oh, you should try meditation, you should try this, you should try that. But we don't really focus on changing the way that we're thinking about the situation, right? Because we might still be stuck in that it shouldn't be this way. She shouldn't be in so much pain. I shouldn't have to spend this many hours, taking care of her, or, any number of other sort of thoughts that we might sort of be stuck in. But when we come to this place of this is what she needs, and this is the situation that I'm living in, and I've accepted that she's coming to stay at my house and I'm going to be providing care for her. What does it look like to take care of myself?
Mm-hmm.
Yeah.
Yeah. What does that look like? Yeah.
Yeah.
And I guess that's the question. Yeah. I think that that recognition is just really, really big. And yeah, for those caregivers to determine, how they can meet their own needs and the need of the person they are giving care for. So how might somebody explore this? Would you make a list as a coach? How might you coach someone through coming up with some answers or solutions?
Yeah. I mean, I think, a first step is really deciding to sit down and even sort of map out the schedule, if you will, of, what are the caregiving responsibilities and how much time do they take? And, are they things that I specifically need to do, or are they something that someone needs to do? And are there things on that list that really no one needs to do? They're not adding.
Yeah, like a needs assessment kind of.
Yeah, exactly. And once we do that and we kind of look at the reality of, how much time it's taking, really sort of getting quite real about the time that it takes, right? Then we can start to, again, sort of decide, is there stuff here that I can delegate? Is there stuff that I can ask other people to help with? Is a service that I can, hire somebody else to do? And then, looking at that cost benefit of, it might cost me money to, let's say, hire someone to help with the laundry or the cleaning. That might cost me money.
Yeah.
But if in return I get, an hour or two back into my day or my week, like whatever that looks like, that might be worth it so that I can take care of myself. I can decrease, some of the responsibility that I'm carrying around, and be able to get the help that I need. And it's a different way of sort of looking at that cost benefit analysis. When I'm working with physicians, we're looking at the schedule of patients, who's, patients on the clinic schedule for the day. And so many of my physician clients will look and they'll see, there's patients scheduled every 20 minutes. And yet they resist that and decide that they should have 30 or 40 minutes because your physicians, really want to take great care of their patients. And that takes time. Yeah. But if they're constantly walking around thinking that I ought to be spending 30 to 40 minutes with my patients and giving that time to people, they're running late. They're providing a lot of extra time with patients that they're not getting paid for. They're spending way too long at the clinic and way too long charting after clinic, kind of all of those things. And they're feeling very run down. And part of it is that they are not really looking at the reality of this is the schedule. And I don't have to like that I need to see patients every 20 minutes. But if I want to take care of myself, I need to acknowledge that that's true in this particular job.
And that's true in what's that?
What's that?
That it's true, and what was the second
part?
In
this particular job.
It's true in this particular job.
That is the reality in this clinic that I work in, for example.
Okay.
And I need to be accepting of that and decide what I am going to do.
Very good. Yeah. Can you make it work?
Yeah. Can I make it work? And, if I can get really real about, okay, this is what's being asked of me. And, this is how much time it takes. And this is this. And, the ways that I might be able to take care of myself is this. And can I delegate and all those questions? Yeah. Then you can really see, does this work for me? Is this doable?
Right. And the answer might be, I need to make some kind of change, whether it's with a job or a caregiving role or
Right.
whatever it is, really. I mean, that would be a big insight to come to.
Yeah. Yeah. And I don't know the literature, in terms of, kind of the role that caregivers play, but there was a study that was published last summer that showed that primary care physicians need 26.5 hours, I think, per 24 hours in order to complete all of the tasks that are asked of them.
Yes.
In terms of caring for a panel of patients, including, vaccines and acute care visits and chronic care and all the responsibilities. And I point that out to people all the time.
And there's literally not enough hours in the day.
Literally not enough hours. Some of those things are going to get dropped.
There's an anesthesia study like that where it was about hand washing, and you literally could not wash your hands enough in the day for all the things that you do. Like it would literally suck up your whole day. You could never care for anyone because you'd just be washing your hands.
Just be washing your hands all the time.
Basically, yeah. The amount of contact in the OR and 20 seconds a piece for everything.
But similarly, if you think about responsibilities that a caregiver might have, including, preparing meals, serving meals, if they need to assist with the actual, eating of the meals, if they have laundry, if they have cleaning, PT, all of those things.
Yeah.
I'm going to guess that we're going to be in the same boat, right? There is way more work there that could be done by one person than would fit into 24 hours.
Yeah.
And not only is that not good for us, but it's also not possible. Right? It's not possible for one person to do more than 24 hours of work.
Yeah, not to mention sleep.
Not to mention sleep, going to the bathroom, feeding themselves, maybe seeing family and friends in other situations, all of the life stuff.
Oh my gosh. Yeah, no, I think it's so true. Well, and so, at some point you have to almost find some practical tips, right? Some, real world things to, whether it's, I don't know, a meal service or really quick foods or preventing a mess rather than cleaning up the mess. I don't know. There are many things I could think of.
Maybe, again, in that scenario, if I'm taking care of mom, maybe my sister lives in town and she doesn't have the bandwidth to take care of mom, but she could drop off some meals. Right? Or she could help, with some of that. Or, perhaps I've got somebody down the street who, could help with laundry or something, and I can pay them, some amount of money without contracting with an expensive laundry service.
Yeah.
We can use flexible thinking to solve some of these problems,
but
we'll never get there if we are feeling like I have to do all of this myself. I should be doing all of this myself. And not really sort of looking at the reality of what is being asked of me.
Yeah. No, and I think this really brings like an issue of maybe even like the American idea of the nuclear family, right? Like the idea that this, mom, dad, kids should be able to function as an independent unit. And like, I just don't know if that makes a lot of sense.
Doesn't work in my family.
Right. And then how much more are those demands if you have a person who's disabled in the family or, somebody with chronic health issues, it just really takes the whole, the whole thing to another level of complexity and challenge when, frankly, just, doing life and doing, one or two jobs in a household can be enough to occupy everybody. Yeah.
And I'll tell you another area where I see a lot of, kind of resentment build up in this scenario is, often when there is one sibling who is doing the bulk of, the caregiving work, and there are one or more siblings who are not. Sometimes the sibling who's doing all the work has decided that they, for some reason, sort of need to do all of the work because they've always been that person.
Yeah.
And they may have a little bit of martyrdom going on and, just this kind of over-functioning role. And sometimes they've never sat down to look at the list of all the things and all the time that they've spent and, really decide that they need to ask for help and to be very clear with those other siblings of what are the actual tasks? So instead of asking, can you help me? Ask very specifically, I need help with, doing mom's laundry. Can you come once a week and help out with that and spend 2 hours or something, being very specific and concrete
Mm-hmm.
with those individuals about what is needed. That helps everybody, right? Because if you just ask people, you just tell people, I need more help, but you aren't specific about what the tasks are, and you won't really let go, of some of those tasks, then you're not going to get help.
Yes.
So when we can be very specific and very clear, I need help with these specific things. If you, what are you able to help with? And if you can't help directly, can you help, to provide, money in order to, to get some of these services hired out?
Yes. No, I think that makes a ton of sense. And I like what you had said earlier too, about even the idea of bartering, that I could imagine, maybe not as much in the family situation, but if you were looking for help with certain things, or even, hey, my sibling that doesn't have time or doesn't have money maybe to help with mom can either donate their time, can barter for something else with another person, and find a way to provide for some of those needs.
Yeah. And often I think, again, for people in this situation, we're often waiting for other people to help. We're waiting for other people to notice how hard we're working.
Yes.
And to jump in.
Mm-hmm.
And say, I've got this. You go take a rest, right?
Yeah.
That doesn't happen very often.
Mm-hmm.
And, people may think that we're superhuman because we've just been doing it all.
Mm-hmm.
And not really realizing, how hard we're taking it, how much work it's costing us.
Yes.
You think about kind of the caricature of the mom who does it all, right?
Mm-hmm.
And everybody thinks she's just a superwoman.
Right.
And really, she's exhausted. She's resentful. She wishes that people would pick up their own darn socks, but they're not.
Mm-hmm. Mm-hmm. Yep.
We can decide, right, that we're going to start going out and asking.
Mm-hmm.
And we might get a no, but at least we're able to sort of shut down that thinking of they should be helping me and they're not.
Yeah. Yeah. Here's a challenge that I've run into. What if you ask and then people say they will, but then they don't?
Yeah. Yeah.
That can be challenging.
That certainly happens a fair amount as well. And I think, there can be a reminder and there can be a request of what I really need is someone to come, once a week and do this thing. Can you show up on this day at this time and do this? And just be very direct and clear. We often might think that we're being direct and clear, but we're really not. There's a difference between asking if someone can come once a week and asking if they can come on Friday morning at 11.
Mm-hmm. Yes.
Right?
Yes. Scheduling it, making it.
Scheduling it, actually making it very real. And, you can learn very quickly if they, say they can, but they just are constantly sort of flaking out, then that's your answer, right? I would give them the grace of, a couple of times of doing that, a couple of reminders. And if they're not going to do it, then I'm going to take them off of the list, at least for that task.
Yes.
I guess I think people run into that a lot.
Yeah. Yeah. I think, it can be an impediment for sure. And
it creates a lot of resentment in families. And, I think we start carrying around a lot of expectations about what other people should and shouldn't be doing. And we can have those ideas, but that doesn't move the needle in terms of getting people to actually follow through. And so we can choose to be direct and clear. And again, choose to give them some grace. They're allowed to make some mistakes and, try and fail a few times. But if they're consistently not showing up when they say that they have, let's believe them that, their actions are speaking there. and let's move on rather than, staying stuck in the idea that they ought to be helping and they're not.
Yeah. And so then at that point, you might just have to reconcile to, that's not something I can get from this relationship, from this person.
Right. It's, again, looking at the reality of what's going on and deciding, okay, that's not the avenue. I'm going to try something else. And I think when we can be very clear about that for ourselves, then again, we can sort of get out of that resentment, at least a little bit, right? It's normal to be like, they couldn't even do this. They couldn't be, I'm doing all of these things and they couldn't even show up and, help in this way. We could spend a lot of energy there, but it's not going to help us. It's certainly not going to help the relationship. And I think it's better to acknowledge that that didn't work and to decide to move on.
And maybe there's something else to ask for. Maybe there's not.
Correct. Yeah. They may be really good at doing something else. There may be something else that they would just naturally be a better fit for. They may have more time than money, or they may have more money than time. If there's something there that we can recognize that they might be able to do, great. But some of the time, people are just not going to be reliable and they're not going to help. And again, I think let's just agree that that's the reality and move on.
Yeah. And so, and this is really part of that, establishing those healthy boundaries, what you can and can't expect from people. That's all part of this boundary work, I think.
Yeah, absolutely. Absolutely. There's a principle that I teach frequently that comes from Brené Brown in one of her books, Rising Strong. And it's the idea that what boundaries do I need to have in place in order to stay within my integrity, making the most generous assumptions of other people.
And let's talk about that a little bit.
Yeah. So, when I'm talking about this with physicians in the care that we're providing, we are understandably not willing to compromise on the integrity of the care, right? Like we want to provide safe, high quality care. When we don't, there are all kinds of problems. But, by and large, we're going to really be sticking with that principle. But if we don't have boundaries, then we will often be, stuck in this place of being very resentful of other people, really compromising that generosity piece.
And so tell me this phrase again, what boundaries do I need to have in place to continue to, is it operate in my integrity?
Yeah, in order to stay within my integrity, making the most generous assumptions of other people. And so the generosity piece is, if I want to believe that people are doing the best that they can, and, and again, accepting that what I see in front of me is the best that they can do right now. If I want to just make that assumption, make the assumption that they're not trying to lie to me, that they're not trying to manipulate me. Like this is them acting their best. What do I need to do to take care of myself in that situation? So, for an example, let's say, let's say we're getting coffee, right? And the person who is ahead of us in line, starts yelling at the cashier.
Okay.
Right? I can think they're a terrible person. I can think all kinds of, kind of nasty things about it. Or I can assume that this person is having a really tough day, that, this is the best that they can do right now. This isn't a great example in terms of the boundaries, but just, do I want to focus on them being a terrible person, or do I want to think that this is a person having a really bad day?
Yeah.
And, this is kind of all that they can muster right now.
Yes.
I'd rather go through my life thinking that.
Yes.
And let's sort of think about, kind of a toddler, having a meltdown. We can think about that as this toddler is completely overwhelmed and frustrated because, they can't get the toy that they want. And the only way that they know how to cope with this overwhelming emotion is to throw themselves on the ground, and be kicking and screaming.
Yeah.
Right? If I see it through that lens, right? If I can see them as they're having big feelings and they don't know what to do, about them, and I, stay in my integrity, right? Of like, I'm not going to yell at them and belittle them and, approach them in that way. Then what do I need to do? I might need to take some deep breaths.
Right.
I might need to make sure they're in a safe place, walk into the other room and just shake it out because I've already had a day with them, and then go back, and try and sit calmly with them and say, you're having some big feelings. This is making you feel upset.
Or if that's my toddler, I might be thinking, this is embarrassing if it's in a public place. And maybe like, that's where I need a better boundary, right? Like, is that for me to be embarrassed about? I don't know.
Yeah. I mean, we can certainly, decide, that's the case. We can decide, that the boundary is, if they freak out in the store like that, I'm gonna leave the store with that, like, I'm gonna take them out, or I'm going to, we're gonna move over to a corner, or the boundary might be, kind of for ourselves of, I know that I've seen other parents in this situation.
Yes.
And I'm not gonna make it mean that I'm a bad parent because my toddler's having a toddler freak out. Right? There's kind of a boundary of not shaming ourselves.
Yeah.
For this freak out that, we all see happen every time we go to the store.
Right. Well, and I think, we've all seen it. We've all experienced it in one manner or another.
Right.
And this is a question that a person might ask themselves, like, what scenario would you use this question instead of thinking?
So let's say that I'm caring for a family member at home, and let's say that they are someone with chronic pain, and on their bad days, they tend to be really snippy and irritable. Okay. And so in this framework, if I can recognize that, and I can assume that they're doing the best that they can today, right? That with all the things that they have going on, all the pain they're experiencing or the frustration, I think about this in particular with, people who are caregiving for someone with dementia, who might tip over into kind of that meanness sometimes.
Yes.
In order to be in my integrity, right, to make the choices that I want to make in that situation, again, I may have to, set my boundaries and say, it's not okay for you to talk to me that way. I'm going to go take a break, and I'll come back, and I hope that we can have this conversation again. Right? We can be just very clear with somebody. It's not okay for you to yell at me like that. We can say, if you choose to, if you choose to be upset with the way that I've cooked the dinner, then you can choose not to eat, but I'm not going to go and cook you a different dinner. And the way that she describes boundaries is simply saying sort of what's okay and what's not okay.
Yeah, what's okay and what's not okay. Yeah, with me or with
me. Yeah,
between us, maybe. Yeah.
And that way, I can acknowledge that the person is having a difficult time or experience, right? I'm assuming that they're doing the best that they can, but I'm not overextending myself, and letting them walk all over me. I'm being clear. Of course, that will look different ways, again, sort of depending on all the circumstances of the situation.
Right.
But these scenarios come up a lot. And when we aren't used to having any boundaries, when we are just kind of used to taking it and, just kind of shrinking down, it often leads to a lot of resentment, or, us taking actions that we don't like. In the parenting scenario, that leads to us yelling at our kids.
Yeah.
Right. That might be outside of our integrity. Right. I don't want to be yelling at my kids. I don't think that helps the situation. It's not who I want to be as a parent. It's not the household that I want to have. Right. But if I'm not taking care of myself and setting some boundaries, then, I'm much more inclined to yell.
Mm-hmm. And how do we know when we're within our integrity? I mean, what, that is a feeling, that is something we might want to reflect on and articulate. Tell me a little about that.
That's such a great question. The way that she defines it is choosing what is right over, what is fast, fun, or easy.
Okay.
And so, and again, the rightness would be according to your own, sort of internal compass. But let's use the example of yelling, right? If I want to create, a household, kind of family relationship where we can talk about hard things and we can be upset with each other, but we don't just yell and scream at each other.
Yep.
Then I decide, right, that yelling when I'm angry is not okay. Right. And so if I yell, I'm choosing, what seems fast and easy as a response to, sort of discharge my anger in the moment. And I'm outside of my integrity. Rather than, right, acknowledging that I'm feeling really upset or frustrated or, whatever those emotions are at the situation in front of me, and choosing to kind of pause and acknowledge for myself for just a moment before I respond. Right? It's kind of that reaction versus response.
Yeah. Fantastic. Yeah, I think that's so interesting. And that place of integrity, seems to me like it may be a unique exact spot for each person.
Mm-hmm.
Yeah, it's so important.
Yeah. And it's going to look different, for each of us, right?
Absolutely. Yeah. Well, thank you so much for joining me, Dr. Melo. Dr. Megan Melo, board certified family medicine and obesity medicine. She's also a certified life coach through the Life Coach School, certified a Daring Way Facilitator. And so that was what we were speaking about, Brené Brown's Daring Way. And that's from her book, Rising Strong, did you say?
Correct. Yeah.
Yes. Excellent. That's so exciting. I appreciate you being here and talking to us a little about burnout and frankly, just understanding this topic better, how to avoid it. So many caregiver physicians in our circle and just so many caregivers, I would say, that I see in my population on a daily basis. So Megan Melo, thanks so much for being here.
Yeah, thank you so much for having me, Sarah. It was great to get a chance to talk to you.
Yeah, my pleasure. All right. Well, signing out from Lifestream Health Center. Have a great Friday.